Dr. Sykes, we can start with you on over the weekend. We went to stay at home, which starts at midnight tonight. How does that impact the hospital?
It does. I think that's was a vitally important thing to do, and fully support from a medical standpoint that stay at home can really help us flatten the curve. The data around that is very strong, and I think it's the one major thing that we can clearly do that can change the outcomes of this disease. We know that stay at home and shelter in place will lower the number of people who become ill, lower the number of people who die, and lower the number of people who have to try to come into the healthcare system. So that is vitally important as the novel coronavirus continues to spread. So from a healthcare standpoint, I don't think there was anything that could have been done more dramatic, and would urge that be done as widely and broadly as possible. Dane, anything you want to?
No, I completely agree with that. That has been one of our underlying messages from the start, and I think that still continues to be very consistent. And continue to follow that as much as we can, and have everybody continue to be responsible and adhere to this public health guidance, and really try to stay home and stop the spread of the infection.
We can open up for reported questions right now.
So, hey, everyone. I've got a question about the stay-at-home as far as neighbors go. We had to basically tell my kids this weekend that they could not play with their neighbors, with all of them being out of school and at home. Is that probably fair practice, is to tell kids they really shouldn't be spending time with neighbors, especially not in their houses, but even outside?
Yeah, I think that's been very consistent from even when the first mandates or orders or instructions were coming down, is that even play dates and things like that are probably not the right thing to do, and to really keep everybody separated if you can.
I mean, that's hard as a parent who, my kids are older now, so it's easier for them to stay at their own home. But when they were younger, I can't imagine that, gosh, you're going to be at my house all the time, and they don't get distracted. But that is the right thing to do, because children are asymptomatic. They can spread the disease from one to another. That can come to the adult, and especially if there's any older folks in the house, then that's where the risk is, or anybody with any comorbid diseases. And that's how coronavirus gets spread. The more you can sequester yourself at home, the better off you're going to be.
And even more so, just anecdotally, I have a teenager, and more so for teenagers who are a little bit more independent and able to come and go more or less as they please to a certain extent, and they will have a lot of contact with each other, and it's very difficult. It's a difficult decision, but it's the right decision.
And that includes just like playing out in the street and stuff too, not just coming into each other's homes. That means
you bet.
You
That's
stay in your
exactly
home,
right.
but stay in mine.
Yep. Yeah, it's that contact. It's that close contact, and that makes all the difference. And again, shelter at home works, but you really have to follow those basic ideas and not go out into gatherings in public. And Dana can comment too, but I believe that Germany just implemented a no more public gathering than 2 people.
Yeah.
So I think you can see where these measures can head.
And again, what Dr. Stites wanted to emphasize was the contact. Certainly for adults going out and walking on a trails or going to a park, that's different than children who are in continual contact with each other, and their interactions are quite different than adults in that way. So that's the main focus there.
Even if you're at the park, 6 feet apart. I mean, if you're with your spouse, I think that's one thing. But if you're in the park, otherwise 6 feet apart. If you see somebody else coming to you in the sidewalk, walk around them, so that way you maintain that distance. So if they cough or sneeze, they're not going to spread the disease to you.
Can you talk a little bit about the difference between isolation and quarantine at home? And try to be as specific as you can. Let's say that my husband gets it and I don't want to catch it, but he has to live at home. I can't send him somewhere.
Yeah, historically, there has been a difference between self-isolation and self-quarantine. Self-quarantine seems to have been more if you think you're exposed. Self-isolation has been more directed towards somebody who has known disease, trying to maintain a distance as much as possible in the household. Obviously, some households it's easier to do that than others, but trying to stay in an area away from the rest of the household members, whether that's a separate room with its own bathroom. Doing that as much as possible is trying to stay isolated in the household as much as possible, and there certainly is good guidance for that on the CDC website as well. And that's difficult. I mean, all of these things are difficult.
Any questions out there?
Yes, this is Lisa at the Kansas City Star. Could the doctors say whether they plan to use hydroxychloroquine on their patients? If you could share your thoughts on that, since there's a lot of talk about that. And also, can you tell us what you're doing to support the mental health of your staff in a situation that's clearly stressful for everyone involved? And I know we talk a lot about having enough PPE, but if you could tell us what you're doing to support their mental health, that'd be great. Thanks.
Okay. Yeah, this is Dana Hawkinson. First of all, on the question of the therapeutics with the hydroxychloroquine, we have a good group, a smart group here looking, and who have been looking for the past several weeks about all of the active agents that have been tried or published upon. Obviously, we know about a couple of the drugs through the media and through President Trump's press conference yesterday. Those are all on the table. We have criteria for those. People are actively getting some of those drugs in the hospital. But again, we have to remember that none of this is FDA approved. There isn't clear benefit. Some of these drugs the use is based on anecdotal evidence, but also some very small published studies. But we do have people here in multidisciplinary group that is working on therapeutics, putting together criteria, and yes, we are currently using those on some of the patients that are here.
And they're used in some places in investigation. I think of our intensive care unit, since last week they started a hydroxychloroquine plus azithromycin protocol that has been operationalized now for 5 days for patients who are ill, and they may be adding other investigational agents to that this week. So there's a lot of work done to try and shorten the course of the illness and to make it less severe. This is Steve Stites, and relative to the question about mental health, you know, you're right. That is a big deal. I think clearly the staff, be it the nursing staff, medical staff, or anyone else here with our health system, and anywhere you've seen where there have been a lot of COVID illnesses, there is a great deal of stress that occurs and fear for your own personal safety. As we've had to cancel clinics, one of the things that has done is freed up a lot of time for our psychiatry team, both psychologists and psychiatrists. So we're working, and I believe we'll be rolling out this week a mental health program and actually we have one where people can call in. I think we'll make it even more accessible for our faculty and staff. And as well, we're going to telemedicine visits that start today, and within 2 weeks our entire clinic calendar will be filled with all telemedicine visits. And that will access for our patients, et cetera, who are having stress at home. Hopefully we can try and help with that some as well. So definitely for our staff and faculty, hopefully that'll be extending into the outpatient arena over the next several weeks.
Yeah, and kind of getting back to the drugs, the therapeutics, I'd also like to mention and note that these drugs are not benign. I've had several physicians who regularly prescribe them or see the side effects from them talk to me about that, as they are concerned about not giving in the right doses and having significant side effects. I just saw some reports today from Nigeria about people that had actually overdosed on chloroquine. So those are not benign things either. We need to take all of that into account, especially safety, but certainly we are looking for therapeutics for this infection as well.
Andy Alcock from 41 Action News. A couple of questions. I apologize if you covered this ground on a little bit late. Can you talk about what is being done at the hospital in particular to prevent any spread of the illness? And can you tell us how many patients you've actually seen to this point?
Well, the numbers we're going to talk about this evening, we have a press conference later today, and you'll hear more about all the specific numbers. But Dana, you can talk especially about what we're doing around our personal protective equipment so that to help prevent spread between patients to our staff, or vice versa if you have a staff member who could be sick and could spread it.
Yeah, I mean, first of all, in the hospital in general, I feel more safe here than in the community. And why is that? Number one, I think we really stress hand hygiene and training in hand hygiene in appropriate times to do that in appropriate ways. We also do have the personal protective equipment, or the PPE, and so we're using that on the appropriate patients to help protect the spread. So as far as in the hospital, I think that is the main focus that we're working on.
We also have, like when I came into work today, I had to have my temperature checked 98.6, and all of our staff have to have their temperature checked when they come in. We also have to self-identify. We're asked, are you healthy? Do you feel well? And if not, or if you have a low-grade fever, then you have to head home. So I think that we are doing things to try and help keep the public safe. We don't allow many visitors, but any visitor who does come in has to have their temperature checked as well. And I think that, so we are really taking active steps, and we know from data that's coming out of Singapore, China, and other areas in Washington, that if you do these measures, there really is very little staff to staff or staff to patient or patient to staff transmission of the SARS-CoV-2. And by the way, we have a lot of people working at home, so the campus isn't full. That's the other thing we've implemented. Anybody who can work at home is working at home right now too. So we're trying to follow our own advice.
I have a question about kind of bang for your buck, preventative measures. Obviously, with now more people staying at home, that's a big part of it. We know the self-distancing is a big part of it. But when you go to the store, you see people doing different kind of preventative measures, whether it be wearing gloves or masks over their face, that kind of thing. I know you don't want to discourage people from taking precautions, but are there things that make more sense than others when you do have to go out and venture in the public right now, besides the staying 6 feet away from one another? Are there things that I can do when I go to the grocery store that make more sense preventative-wise than others?
No, I'm going to pick a couple, and then I'm sure Dana will have some as well. You know, everybody wants to know what the secret sauce is. And the secret sauce isn't a secret. It's wash your hands, wash your hands, wash your hands, wipe down surfaces that you touch, and then don't touch your face. And even if I touch, like I'm sitting here at this table now, my hands are on the table. As soon as I'm done, I'm going to Purell my hands, and I'm not going to touch my face in between. I started to a moment ago, and I had to stop myself. I have to think about it constantly. I open a door, there's a doorknob. How many people have gone through that door? How many people have touched that same doorknob? I had to go to the grocery store yesterday. I reach into the shelf, I grab some, I don't know whose hands have been there before. So what do? I try to Purell my hands, and I try to wash my hands as much as possible. And you're not going to get the virus because it's on your hands. You're going to get the virus because you take your hands and you touch your face. So consciously think, I'm not going to touch my face. I'm not going to touch my face. I think it's kind of like rehearsing your ABCs. If you just keep doing that all the time, you're going to make some progress around it, and try not to do that. So it's really that there is no secret sauce. The most important thing you can do is what you know, you just have to practice it. Dana.
Yep, I would certainly echo that. I think that's very important. You know, just going to the grocery store last week, I didn't have hand sanitizer, but I was conscious, and I knew that, okay, so I am picking things off the shelf. Could there be the virus here? We have to act like it is, and I just made the conscious effort not to be touching my face. And it's difficult because we've seen many studies where people are touching their face many times an hour. One of the most recent was at least 20 times an hour you're touching your face, if not more. But as you start to make it a conscious effort, probably after a day or two, it's going to become unconscious. And if you can avoid doing that, then I think that's going to be a major way we can stop the spread. And that is coupled with the hand hygiene.
It's really hard right now because it's allergy season, and all I want to do is scratch my eyes, rub my nose, rub my face. I mean, and the more you don't do it, the more you think, I got to do it. I really want to do it. You just have to remember, it's not the thing to do. It is how the disease is spread, and so if you want to protect yourself, then protect yourself.
Hey, this is Brett from Channel 5. With the Core 4 and the order that's going out, is that, and I know we're a major metropolitan area, but is that big enough area? Should we get the surrounding counties as well? I mean, what's your opinion on that, guys?
You know, here's what I know. Shelter in place flattens and changes the curve of this disease. There is absolutely no question about that from a medical standpoint. Just no question. Now, whether that can be implemented in any given region, that is a political discussion best left to the governing body of that county or that region or that state or that part of the country, because there are so many factors people can have to consider. So we're not going to, that's not for me to say. What I can say is that there is absolutely no question that you can decrease the number of people who get sick, decrease the number of people who die, decrease the number of people who are in the ICU if you do shelter at home. I mean, there is no question about the medical data around that. It's coming out of every place that's done it. This is the most important public health measure a society can do. As an individual, it's wash your hands, keep your distance, and stay at home. As a society, it's this shelter at home thing.
I'm wondering about the number of test kits that are out there. We've been told anecdotally that Quest Diagnostics, for example, and LabCorp and some of these other private businesses are starting to supply testing kits. How are you guys getting testing kits? Are there adequate supplies out there? And do you have enough ICU hospital beds if this thing gets to a point where, you know, a lot of people have to come to the hospital?
Yeah, we can, you know, as far as the kits go, we are currently looking at and using several different places. You know, we still have some state tests, some private labs. We are exploring all of that, and I think, and hopefully this next week, certainly more will become available. But that's the current state is, yeah, we are using several different places and looking at those and looking into other places. Every institution is looking at other places as well, but we are certainly able to use the labs, and we're just kind of waiting in general for further kits and exploring other options as well.
I think there are more kits available this week than last week. I think that whole situation has improved, but it all depends upon the number of patients who have it. We will quickly overwhelm those labs if what happens in New York happens here. And so that's really what the question is, just how are we doing? And it's a little hard to know because we don't have as many kits. We haven't been testing as many people up until, because we didn't have as many kits, we weren't testing as many people, and so that it's harder to judge exactly the spread of the disease. But I think it is a little better than last week. Now, if you're going to use the Quest kit, it's got to go to the Quest lab. So nobody's giving you kits. They're only allowing you to use their kits should you choose to use their lab. Relative to the question about the number of hospital beds, you know, and this is true across the country, we have been modeling for how many patients we think we can take, and we know what our equipment, our ventilator capacity is, and we believe we have the right amount. But it is, again, it just comes back to that curve, and you've all, I'm sure you guys have seen those projections. If the curve goes straight up, it doesn't matter how many we think we have, we will overwhelm the ability of the entire area to have enough hospital beds and have enough equipment and have enough ventilators. So it all comes down to flattening the curve. If we can flatten the curve, we're going to be fine. If the curve goes straight up, then that's going to be a harder day, and it really, that's why this shelter at home thing is so critical. As it stands right now, though, we're in really good shape as far as beds and ventilators, et cetera, but we're just at the beginning of this crisis.
And the protocol is for only really sick people to be tested at this point, is that correct?
You know, the protocol is really for people going into the ICU, but we'll see how we're able to expand that, or what we can do with different degrees of disease.
For the health system, what is the benefit of the testing? I heard on the news this morning, listening to national news, that there's a prediction that testing will become moot because of, in New York, for example, where up there they're anticipating 80% of the population is going to get this because of the dense.
I think so. About the testing, there are a lot of aspects to that. Are we testing to identify the disease? Certainly if we have people who are sick and needing higher level of care and critical care, we need to understand why are they sick. Is it due to COVID? So certainly testing there. The other aspect is, are we testing so that we can get the proper precautions in place when we treat them? So if we know they have COVID, obviously we'll take the proper PPE or personal protective equipment precautions, versus somebody who has a routine diagnosis that isn't COVID. Do we need to be utilizing those resources for that specific patient if they don't have it? And so there are different aspects and different reasons to be testing, and that's for knowledge, again, to keep our caregivers healthy, to keep our other patients healthy as well.
Do you think
Hi, this is Melissa with Channel 41. Bouncing off of that, it looks as though the latest numbers out of Missouri show the majority of the people who are testing positive for COVID are in age group 20 to 29. Is that reflective of who you are treating, that age group, or is that just tied to who is getting the test?
Or is it tied to spring break, or all of the above? I think it's probably likely tied to spring break. Yeah.
I think that here we're seeing, certainly as consistent with the other data, certainly in the hospital, probably the older patients. I think it is more of a function probably of just who's getting tested, but we're really seeing all ages. It's hard to take a snapshot and make a broad stroke opinion about that, but I think we are seeing all ages definitely of infections.
I think a lot of individuals last week quit testing people in the public because of community spread, and as a result it's going to distort the data. I'm not sure that's as reliable as we would like it to be. The inpatient stuff, the people who are getting sick are older and have comorbid illnesses. We're no different than the rest of the world around that, and I think I wouldn't expect that to change. As far as young people getting either maybe they went and got tested more often, or B, they truly were. I mean, spring break was a big deal, and people going to Colorado or Florida are going to have a higher incidence of being positive. So.
This is Joe with Channel 5. Just wondering, in terms of testing kits, do you think this is the biggest issue we're facing right now? We're hearing from people who say that they are showing symptoms not severe enough to get them to a hospital, but that they're at home and they want to take a test, yet they either can't, or where places they can find them, it's $150 to $200 to get it and they can't afford it. What do you say to those people, or what is the current status of testing kits and also the cost of them that you think needs either addressed or fixed?
So, okay, there are a lot of questions wrapped up into that. So let me try to unwrap that a little bit. First, does everybody want to have an answer? You bet, and I totally get that. But if you don't have the resources to do that, then you have to say, who do I have to prioritize the testing for? And I think the answer to that has been inpatients. Third, if you are at home and feeling sick, you just have to self-quarantine. And now, there is a desire to know if you have this really bad thing, this SARS-CoV-2, and I get that. And if we have enough testing kits and enough ways to process those tests and enough swabs, et cetera, then that's great. Let's go do that. Let's go find out. Because I do think it will put people at ease. But on the other side of that, until we have that, we have to be able to prioritize the inpatient testing and the testing of people who are in a higher risk category. Remember that for over 80% of the patients, they're going to be fine. They're going to be home, they're going to be sick for a few days, they're going to feel crummy, and then they're going to feel better. And I think that's really an important message. It also is another reason to get back to the base concept. Shelter at home, shelter at home, shelter at home. If you don't go out and you're not around people to make you sick, you're not going to get sick. And that's really the key message here, right? We got to drive that home. And then I think, but yes, it would be great if we had all the unlimited testing supplies, and that may happen in a month. There are so many groups trying to rev up to do that. We may be able to loosen those criteria and get all the results back, and that's better for public health information. That's better for understanding how the next pandemic could work. So nobody wants to restrict that, but the reality is you have to test certain populations first to make sure you offer adequate care for them, and then yes, let's go try and get folks. The other thing to say is, if you're in a hospital and you're a person under investigation, or what we call a rule out, then what's happening is you're using a lot of personal protective equipment that you may not have to use if we could find out the result of that test right away. That's one of the reasons we don't want to have a backlog of tests in hospitals. We don't want to burn through the PPE.
And that leads me to my next question, actually, about PPE. Working with doctors at the University of Nebraska Medicine that I've been talking to in Omaha, they say that they're looking into reusing some of their PPE. They're developing this way to use infrared technology to make what was once only usable one time now be worn even more. It's not an ideal situation, but they say that's where they're at right now. Is that anything you guys are looking at doing?
Yeah, you bet. It's ultraviolet light, not infrared light, just to say it's a little different. But Dana, you want to talk a little bit about that? I know we've got some groups that are kind of zoning or zeroing in on using that exact plan.
Yeah, I think, we here, for the last week have been looking into reusing certain PPE or extended use so that we can prolong the life of these PPE, so that we can continue to have enough so that the healthcare workers, when they need it for the patients that they're treating, will have it. And so we are looking into all of those things, different ways to reuse, and continue to look at different ways we can use extended use for things like N95s and other face masks as well.
Remember that one of the reasons we ended up canceling elective surgeries and canceling most of our clinic appointments are twofold. One, to keep people safe, and two, to keep people safe. On the first one is to keep the patients safe so they're not traveling, and on the second one is to keep our staff safe because we don't use PPE on folks who don't have to be here. And so as a result, it allows us to make sure we have enough of that equipment for what we believe will be the surge.
Got it. Okay. And then last question regarding that. Do you feel right now you have enough PPEs, and are you worried about the future?
We do right now. It all depends on whether we can flatten the curve. So what's my answer going to be to that? Stay at home.
Got it.
Okay.
Media sometimes they're under pressure in their newsrooms to find a different angle that they've said and told everybody to wash their hands and that kind of thing. What would you say to possibly the pressure they might be under to find a news story?
Well, here's what I would say. Project two scenarios. Project the scenario of what it looks like if people don't stay at home, and see what happens to the Kansas City metro region then. There's a lot of folks who can help you model that. And then project it if we've really done all that we can. That's a story worth telling because the numbers are dramatic, and I would urge you to take that look at it. Make it feel real to everybody.
And I think on that regard, the doctors have to go, but I want to make sure that everybody understands. Dr. Stites will be back at 5 o'clock tonight, along with Dr. Lee Norman from the KDHE, Tammy Peterman from our
president of the campus,
president of the Kansas City division. And then we will have U.S. Senator from Kansas, Jerry Moran. He's going to join us via satellite. That is happening live at 5. We will be sending more information to your newsrooms on how to join, but we're going to get into the modeling a little bit tonight, I believe. I'm not exactly sure if he's bringing charts and graphs, but I do think that
Dr. Norman is. Dr. Norman's bringing the graphs, he's bringing the goods.
So
Dr. Moran's going to bring policy.
Right. And some of you may have heard in the news that Senator Moran was near Paul Rand. And so he is deciding to stay in Washington, D.C. and kind of self-quarantine or self-confine. Otherwise, he would have been in the studios tonight. I'll be sending more information to your newsrooms. I think you got advisories yesterday. We will do this again tomorrow. Do we know what time, Docs?
We'll take a look. Not yet.